Good morning, everyone. This is myself, Dr. Ruchi Jain. I am from Nagpur and I have been taking Sadhna Series session since 2020 as a mission of taking ahead all the teachings and learnings of Dr. Praful Vijayakar sir. And this has been coming up to you. I didn't knew also that this journey will not only help me to grow, but also the growth will be so tremendous, taking ahead the mission of our teacher, of our master, Dr. Praful Vijayakar sir. We have never seen Dr. Hahnemann sir, but definitely teachings of Dr. Praful Vijayakar sir has got us into the insight of what master's thought process must be and how he must have thought to bring miraculous results from homeopathy. So would also say कि if it is not just a task which is to be done, but by a single doctor, but the whole team should give their whole dedication and devotion towards homeopathy. So let's begin to our session of Sadhna series, which was started with the mission of spreading the teachings of predictive homeopathy, giving tribute to our father of homeopathy, Dr. Samuel Hahnemann sir. Without taking his blessings, a day would not pass in homeopathy. Going ahead to in 2010, as a student of predictive homeopathy, I was really amazed to see the powerful results what predictive homeopathy had given to the students. And sir would always say, it is just not my cup of tea, but also it can be seen that homeopathy give wonderful results from all the students who work hard, who are determined to spread predictive homeopathy and who follow all the disciplines being given by Hahnemann sir very true. Sir would always say, this is a picture of a delusion or what we say, a vision of illusion. If I say, just recognize something which is there in the vision, what you see here is a tree, right? What you see here is not just a tree, you see few lamps. But if I try to perceive in your mind, I try to prejudice with you, that just go and see that there is a male sitting over there and there is a face also which can be recognized. So if you can see all those visible things, that means you are able to perceive the things in full. But this only happened when I had put into your mind that you have to see a male old person with white mustaches. So this all happened when we give instructions to the brain. When the knowledge is perceived in the brain, then only the eyes can see. So Hahnemann sir as guided that we have to be an unprejudiced observer. So there is role of observation into our practice. Without observation, we cannot be a good prescriber. So the power of penetration, our sharp senses are the basic requirement to become an unprejudiced observer. So in this journey of becoming unprejudiced observer, eyes cannot see what mind does not perceive. So this is very true with this picture also what we have seen. He would always say that if you have a knowledge, you will search in the patients. Similarly, if you are a predictive homeopath, predictive homeopathy is equally like a mathematical science. So if 1 plus 1 is 2, in predictive homeopathy also, everything stands true. If it is a pathology, there has to be a cause of disease. If there is a particular disease patient suffering, then the patient's symptoms has to be there. That we have to search. It cannot happen that it is a failure of homeopath for not able to search it. So we are on this mission of restoring the sick to health, to cure as it is termed. Since we call it as mathematics, and therefore this mathematical science cannot be based on just illogical principles. It is based on logical principles and certain defined rules, which we say cardinal principles. So everything happens without a logical reasoning cannot be accepted by the today's scientific world. And Bade sir was the most scientific person who has correlated homeopathy to the advanced sciences. And he was always into the scientific background of researching more and more deeper into his cases and giving miraculous results. But everything is only possible when we are determined, you're dedicated, and you're devoted towards homeopathy. So this is aphorism number 1, which I always take as a Bible story to begin with. And we have to see here is that we are going with the process of individualization. And when we are in the process of individualization, we have to treat the man in disease and not the disease in man. So this is the basic foundation of predictive homeopathy, that we are going with the GCS or finding the constitution who is suffering with the disease. And it is not only the constitution who is suffering with the disease, and we have to also search what pathology, what miasm, what are the presenting complaints of the patient who is coming to your desk. So when we are treating such cases, such incurable cases is also possible only with predictive homeopathy. We follow the rule, the principle of individualistic totality. For me, this individualization doesn't end only with the totality formation. As we all know, totality starts when the patient enters to your clinic. The analysis starts when the patient even gives you a call. Hey, doctor, I want an appointment, right? So everything starts. Every individual will make a call in a different way, right? If a patient is coming to you, starting from the way he talks to you for the appointment till the way he reaches to your chamber, everything is individually analyzed. So this is a great thought which came to my mind. If such and such individualization is there in totality formation, and we have to cure the sick, the individual who is suffering, and it is not only small tips and bits of pieces which we have to cure, but the whole totality. So individualization doesn't end over here of forming totality. Individualization is a process which goes from totality formation, remedy selection, to even Herring's law of cure. How will you define that? Every case comes to you at certain stage of the disease. So it's a moral responsibility to understand what miasm he has come to you. A disease can be psoric, psychotic, and at the syphilitic stage also. So if the patient is coming to you in the syphilitic phase of the disease, then how is it possible that the disease has to return only from psora? No. Herring's law of cure will also vary. We will see it in the later lecture also. That is what terminology is, that it is an individualistic Herring's law of cure, because every case is in a different aspect. So whenever you are perceiving a case, look into it as if a new case coming to your desk. Keep aside all your past experiences and just be unprejudiced when you're seeing this patient as a totality. Because whenever you get prejudiced, this is what I have to see in this patient, you get stuck up, and it is just like defining this whole elephant, that it is just like a fan or it's just like a wall. So whenever you are treating, like every diabetic will not end up having lycopodium, or every symptom of eczema will not be cured by sulfur. You have to see what stage of the disease the patient is. What are the presenting complaints the patient has? Is it suppurative or it is simple itchy? It has got maculopapular eruptions, or it has gone to the destruction level of ulcerations or distortion of the skin also. So when individualization comes up, we get little bit confused. Now, what are you talking about? How it can be individualization in cure process also, or in cases of remedy also. So there is a very beautiful aphorism where Hahnemann sir has really mentioned that the pathogenetic power of the medicine should match the pathophysiology what we want to treat. So definitely when you're talking about individualization in totality, this individualization has to go true with the remedy selection also. If a person is coming to me at the stage of 5th level, where there are so many complications of diabetes, with diabetic foot ulcer, with CKD, or some other complications of diabetes, definitely Herring's law of cure with this patient will be very different than the patient coming to me with an initial diabetic case because the journey has really advanced. The journey of disease with case number 1 has far gone ahead. The pathology has gone ahead from reversibility to irreversibility. The pathology has developed few structural changes which are difficult to be reversible. So therefore, the Herring's law of cure will vary over there. When you talk about psoric cases, when you talk about diabetes has just started in the person, then the different things are different. Similarly, whenever I teach, I always pressurize that you should be very grounded to your roots. You should always stand your feet on the basis of what scientific explanation our masters have given us. And all those things are based upon the miasmatic understanding. Without understanding a miasm, you cannot cure a disease. If you are very sure that you have to crack a disease, then understand what pathology, what stage of disease the patient has come to up. If it is psoric, then it can be simply cured on the basis of sensibility and irritability the patient is there. And if it is sycosis, then please see it is construction, destruction, or it's construction, it's dilatation or contraction and relaxation. That pathologies we have already seen. But as we are moving ahead towards a topic of alopecia or disorders of the hair, we understand that these autoimmune diseases, they call destruction of certain parts and develop faulty organic alterations. What does Hahnemann mean by this? This is what I'm trying to say. That these are the structural irreversible changes which have really crippled the cell and the cell has adapted to a permanent cellular damage. And this permanent cellular damage is in order to preserve the health. It's like if someone is poking me constantly and that constant poking is going to hit me, hurt me, and that whole pain is really disturbing the whole routine, it's better to get cut out of that hand, get benumbed of those hands so that I do not feel the pain and my whole other body is saved. Similarly, if you have a weak end organ, that is you are susceptible to certain tissue changes or tissue destruction in your family, then what happens is the weak end organ gets compromised very easily. Therefore, we see that it is running in families with few destructive diseases or constructive diseases also like diabetes, hypertension, because it goes to the level of tissue affinity or tissue sensitivity. We'll understand these points further. When we talk about psora, we talk about the basic need of the individual, that is nutrition and respiration, because psora is physiology. Psora is something which is the basic need of the individual. It is a generation. It is like something which is essential for survival at the level of body, mind, and spirit. All the three levels. It is the most important need for your survival. So therefore, if a person compromises the psora, the gear shifts from psoric defense to the psychotic defense. And this psychotic defense is nothing but generation, constructive defense, or mitosis. Because when the basic needs are being fulfilled, then the body wants that I should divide. I should let my progeny know whatever I have. I want to advance this. Even if I leave this world, I want my further generation to stay back here and carry forward my inheritance. So that is what psychosis is. But when everything we are living in is surrounded by so many inimical forces, so we need a primary defense of immunity and a protective defense also. But whenever this destruction is targeted towards your own self or targeted towards your own tissue, then autoimmunity comes into play. So, as for now, when you talk about defenses, syphilitic defense is again something for protection, something to regulate a balance between the external environment and the internal environment. We are even not aware of what cellular changes are continuously happening around us. And these continuous cellular changes which are happening inside us is protecting us from all the excavations, all the scavengers who are just entering our body. So this is what the syphilitic defense is. But every disease will start from psora, go towards sycosis, then land up into syphilis. Every disease will have these three phases, and similarly, every disease you will never end up saying that this is only psychotic, this is only psoric, or this is only psora. You have to see where the inflammation started, how it has led from inflammation to psychosis to destruction. This is stages of syphilis which we have to learn. So when we are learning about stages of syphilis, there is exaggeration, there is distortion, there is perversion, there is hysteria, there is destruction and autoimmunity, which is coming to the sixth layer, and then there is genetic mutation. So whenever you talk about exaggeration, as I've told in the previous lecture, exaggeration will have few forms of psora into it. It is like the psora has gone to the level of syphilis. So still in exaggeration, you will see examples of exaggeration syphilis are like sensitivity too high. The senses which are too high, alert. So the sensitivity is like we have got a sensitivity to smell. But if the person says कि I can sense someone is burning far ahead of my place, even 2 kilometers, I can smell it. So is it not exaggeration? Like in opium, we see the senses are so much exaggerated, the person is not able to sleep because of the tickling of the wall clock. So this is where sensitivity is already there. We have a normal hearing sense, but this hearing has gone from psora to syphilis. So this is exaggeration syphilis. So the cases of exaggeration syphilis, still because psora is there, you need to understand that this GCS will be soro, then distortion. What do you see by distortion? So distortion syphilis is like when you see something which is not the true image is. That is distortion. Like I see a pole, that the pole looks blurred. I see an image which is distorted. I see the disfigurements which come up. The structure of the spine like kyphoscoliosis, kyphosis, where the structure is distorted and you have all the stages of syphilis over here. Still, the psora has left over here in distortion. It is more of psychosyphilis. Still, frank syphilis is not there. As we go ahead with the stages of the syphilis, we see in distortion because there is certain like, I'll tell you, distortion is certain like a snake. I will say an example like there is a rope which is there, but I am not able to see the rope. I see the rope as a snake. So still the rope is present over there, which is being seen as a image as it is a snake. So this is distortion at the level of mind where the things are perceived in a wrong way. So still you will see that syphilis has not that much advanced over here in these cases. Then you have perversion. So perversion of senses or perversion over here is where the syphilis is like you will see senses perverted, masochist. Then you have going into sex with the same partners, that is perverted thoughts. Then appetite can also be perverted in a person, right? Someone has got a sense of smell that is perverted, okay? They find something ugly which they feel it is very beautiful, yeah, right? So this is perversion here also is a syphilitic thing. Then hysteria. Because the word hysteria itself say it is hysterical, it is not under our control. Something which is haphazard, something which is bizarre, something which is out of control, something which has no vector or direction. Example, a person with hysteria might behave one moment as happy and gay, but the other moment, when it is the incidents where he should cry, he forgets to cry and he keeps on continuously laughing, and that is an out of proportion reaction or behavior to a stimulus or a stress situation. Then coming to autoimmunity, to the fifth layer, that is destruction. So here, this is a stage where it is psychosyphilitic, right? Where the destruction at the cellular level or at the tissue level has gone from the structural reversibility, that is physiology, has become a pathology with an advancement at the cellular changes, and these cellular changes have so much adapted that the real tissue, the real identity of the tissue is lost, and the cellular adaptation has compromised the whole function of that tissue. That is destruction at the level of syphilis. You can say, like in CKD. What happens in CKD? Because of chronic renal disease, the whole renal structure changes. The nephrons, they go into sclerosis or destruction, and because of that, the whole function of the renal parenchyma is disrupted, and the corticomedullary differentiation is lost at the structural level, which can be seen through the sonography. So any disease which has advanced to such a level that the cellular adaptation shifts its gear from psora, that is physiology, and this physiology, when it adapts, and then there is failure of adaptation, and that is the peak time when the cell says, come on, this is too much for me. Now I cannot adapt to the increased pressure on me at the cellular level. So now I give up. The cell goes either into apoptosis or into necrosis, right? So there is destruction which is going upon, and these cells are getting replaced by some other cells or the tissues, and there can be fibrosis, that is a scarring tissue which can happen over there, resulting into loss of the function. So destruction is also syphilitic. Then you have the sixth layer, where this syphilis, when the destruction which was there, it is guided towards your own cells and your own tissues. As we are born, we know that the T lymphocytes, they are the most important mediators of inflammation, which identify, which do a tagging mechanism, what we say, that as soon as you get separated from your mother's womb, you get your own cells, your own identity, and you are identified as an individual independent from your mother. At the same time, all the whole lot of cells, the thymus gland has the responsibility to release the T lymphocytes, which label the cells that this is my and this is me. And therefore, this will never spoil any cell when the whole immune process is activated, because this is me and this is mine, which should not be destroyed. Then comes to the level of syphilitic level, right? Here, this is frank syphilis of autoimmunity, because the destruction goes unbounded. The destruction goes so much that you become killer of your own cells. So there is loss of love for your life, and there is a kind of reproaching yourself. Those rubrics will come in autoimmunity. Therefore, autoimmunity is taken up under frank syphilis. Then you have genetic mutation. This is where the cell nucleus is under stake. This is where the nucleus or the genetic material which we were given by the mother, the genes undergo certain changes and the mind of the cell goes haywire, and you get all the mutational disorders which cause not only destruction but also distortion, can also cause autoimmunity, can also cause a tissue destruction at the cellular level. And this genetic mutation is therefore taken under frank syphilis. The approach to genetic mutation will definitely be, because this is a frank syphilis, a syphilitic disorder, the compensatory cure is expected, and you don't find a complete cure in these cases. But definitely, we have got good hopes in such cases if we are able to search here in genetic mutation where it is a frank syphilis. The tool has to change. How and when, we will take it ahead. So, since we are talking about miasms, we have talked about syphilis, nothing goes beyond understanding the tissue or the structure. As I always say, that is so there is nothing in this world which has got a no function. Each and every cell of your body has got certain function, has got certain affinity, and accordingly has got its sensitivity. Let's take an example. We have a very beautiful machine where each and every sense organ is developed in a certain way. So when there was a need that I should see the world and I should be able to perceive the colors of this beautiful mother nature. You know what? Then eyes were developed. Eyes gradually develop. If you see the eyes which are there in the amphibians, in the reptiles, in our ancestors, they have got a different vision, right? But when it came to human beings, the structure has got adapted according to the functions we have to play. Because we have eyes in the front part of our face, we cannot see the back side. But our power of penetration in the front is very sharp. So we have a retina, a lens which adjusts itself according to the objects. And because we wanted to perceive the colors, we have the structures of rods and cones which have developed. We perceive the image which is being analyzed in the occipital lobe of the brain. So every structure will have is developed according to function. Then body demanded that I should be able to digest the food, right? But I cannot take the food every now and then. If I keep eating, I will not be able to give myself into the higher purpose of existence, or I will not be able to utilize my energy or all my efforts to the growth of the humanity. So therefore, what did God say? Okay, you want to store the food for a certain time and then utilize it. I will give you a perfect GIT system. In this GIT system also, we have such a perfect balance that as we take the morsel goes inside, then we have a stomach. That is a storehouse, we say. It's a bag which keeps whatever we have eaten, and for 3 hours, 4 hours, the stomach keeps the food and gradually it pushes ahead so that the digestion process goes on, and then the intestine takes the role play. Okay, so we are not like the primitive animals who just eat and they poop. We are born for higher functions. We are born for higher existence. So therefore, the whole structure is made. Now, since we are taking today alopecia, so we need to understand ki what are the structures which are present in the hair. So it's a guideline to everyone. Before solving any case, I'll tell you, please make it a habit कि structurally what are the cells, what are the tissues which have got affected. Then understand what functions have been altered because of this structural change or the disease pathology, and understand what is the basic sensitivity which has hit or what is the stress which has hit. That can be the ailments from. Okay. Now taking ahead to our topic. So we know this hair follicle has got the roots being embedded within the dermis. So you have a bulb, you have a papilla, you have sebaceous gland. Because we have got a very beautiful psora, that is the basic defense. So this comes at the outer part of the body. You must have heard that these hair are nothing but the protein builders as our body gets, and they are not the live tissues of the body. But nails, nail appendages and the hair, they are the proteins which are there in the body. And once you have sufficient protein inside the body, only then your hair and nails, they get the nutrition because they are the outermost tissues of the body. They are connected to the skin, epidermis and the dermis. But the roots is in the dermis and they get a very rich blood supply at the root level, which is embedded inside the dermis. We are continuously exposed to the outer world, and this outer world is showing the challenges like heat, cold, everything. So body says ki I cannot tolerate, and it should have a primary defense mechanism of protection also. So we have sebaceous gland which secretes sebum. It also has got muscles into it, right? So as we all know, that function of the hair is not only related to the skin and skin appendages, but it has got lot many other functions also. So when you see any tissue, please note down what are the functions this tissue is made up of. So this tissue is made up of protection. How hair helps in protection? So whenever you are exposed to cold atmosphere, what happens? It is like whenever you are exposed to draft of air with dust and all, you have all your hair which stack up the dust particles like your nasal hair. This filter, they are the primary filter for the breathing. Then you have hair which are present on the eyelashes. So they protect the eyes from the dust coming inside the eyes. And then you have the scalp hair which shields it from the sunburn. So you have different protective mechanism. Then this hair also helps in thermoregulation. So whenever you are exposed to cold weather, you get goosebumps, right? So that is nothing but the contraction of erector pili muscles. And then when you are exposed to heat, the blood supply, they just relax. There is vasodilatation and there is perspiration. So they act as insulators in cold conditions. And whenever it's also an expression of fear and fright, whenever you get excited, whenever you're talking about something which is true to your heart or something which just pinches your heart, you get a goosebump, right? Whenever you talk about sir, I always, whenever I talk about sir, I get a goosebump. Yeah, actually, my soul, I can feel that it is getting vibrated with it. So whenever you are emotionally charged, that time also these hair help you. So this is something for communication also. So it has got a sensory input. This hair is so sensitive that even tactile vibrations can be felt by the skin, and these hair, they help in assessing these vibrations and movements which is going on. Then it is also having a social and psychological signaling. How social and psychological signaling? Here you will see the story that even animals, they have got so much of hairy body, but because of going into camouflage, because of adaptation, everyone has got different skin appendages. They have got beautiful texture of the skin just to camouflage, just to adapt to the environment. Like a polar bear, it has got such a woolly and a bushy hair so that it can survive even in so minus degree or temperatures also. Then if you say a lion has got a long hair over the hairy body just to make it attractive and look royal. Whereas if you see that this hair has got a social significance also, as we say, ki more the hairy body, it's more masculine, right? People in the past days used to give so much of importance to these hair. People with good strength, stamina, they would keep long hair. Girls who were more feminine, they had long beaded or braided long hair, whatever, but it used to add beauty to their personality and beauty to the whole organism, right? So hair has got its own social and psychological signaling also, and also hair also signifies not only a social part, but also it indicates the nourishment part also. So if you see that it is the color of the hair, right? So if you're nutritionally deficient, your hair is visible that your nutrition is being compromised. You will have hair, the color of the hair which are less. Then also you will see that more femininity, you have long hair. Good protein, good nourishment to your body, you will have a healthy hair growth, right? It also helps because in defense mechanism as wound healing, because it has got few stem cells, and these stem cells in future they help into wound repairing and healing. And nonetheless, this hair strand, it carries our genetic material. The hair, a single strand of hair, if a person gets a single strand of hair, through the hair DNA mapping, we can form the whole organism, his look, his structure, his whole constitution can be tracked back. So if you see, this hair structure has got its significance in so many areas, right? Starting from protection to identity to adding value to yourself, like recognition in the society. If you have got a well groomed hair, you are well ordered in your dressing sense, you add value to your personality, right? So therefore hair is given so much of significance, and being a female, I can understand the importance of having good hair, and you can also understand the importance of having a healthy hair structure. So if you have to understand this, now go. I am a student of sir. So sir would always say ki never give a prepared meal to your students. Help them to prepare the meal by themselves, right? So now we are on the path of understanding that why this structure has developed, and when this structure goes into some pathology or some conflicts, then what should be the conflict which will hurt, or what will be the sensitive will hurt the whole function of this hair. So we should know that this hair has got a certain cycle. Nothing will go or come from the air. It will have certain stages of life also. So from psora to syphilis. So every hair which is born has to die. Okay? Because the cell cycle, every cell cycle keeps on replacing, and over a period of time, a hair, it dies off and it goes away. So what are the phases? So it is anagen phase, because in children, this anagen phase is very active, right? Therefore, children have got good hair growth. They hardly have got hair falls. You can see, children don't complain of hair fall, right? If it is a complaint of hair fall, please take a note in children, because the anagen phase is very active in them. They are in the growth cycle, they are in the growth phase of the life, and therefore in children there should be no hair loss which is very significant. And if it is, then please go and check the nutritional level, because somewhere the growth is getting affected or hampered. It can also happen because of certain skin diseases which have to be analyzed. So anagen phase is where the body is in active growth and there are new cells which are continuously being produced. But mind me, friends, ki this new cell will only be formed when there is an absolute balance inside the body, because this is external appendages. So body will give, this is not the most important organ. Yes, it is an important organ, but more important organs for survival will take up all the energies if there is imbalance or it is a disease phase. And therefore, you see that due to certain diseases, the hair stops growing and they start detaching themselves. And you see in certain diseases that the hair, they actually get separated so fast. In chikungunya, in typhoid, because the cycle was activated to the telogen phase, where the follicles, they don't grow and they actually die off very soon. So they prepare themselves for the next cycle, and the nutrition to the scalp is inefficient, and therefore there is falling of hair in certain diseases. Many viral infections also give you post-viral severe hair falls. Okay, so this is the telogen phase. In catagen phase is where there is stability. The hair neither grows so fast and the detachment is also slowly. Okay, so when you talk about all the nutrition we give, you talk about amla, you talk about high protein diet, you should have good nutrition, you should have good biotin level, calcium level. Everything will affect this hair growth. And more the stress-free life, the more the anagen phase will be activated. Because whenever you are under stress, the whole blood supply goes to the inner tissues and the inner organs, and the peripheral blood supply reduces. So energy is concentrated within. And therefore, if a person says, I have got a good hair growth, I have got a good hair structure, that means it is in a perfect state of health. So this hair cycle needs to be understood whenever a patient is coming to you. If a person says कि हम जब भी बाल धो रहे हैं ना, तो even the hair strand comes up with the white bulb below it. So that is what exactly that the roots are also getting uprooted, right? I have got a receded hairline over a period of time, and this has become very smooth over a period of time. Please mark where this hair fall is and how the hair fall is. If the person has changed the cosmetic and the cosmetic product is not suiting the individual, you will find that these hair fall is so intense. Immediately when they are washing the head, they will find strands of hair just washed away in the washing area. So this indicates that there is certain thing which has attacked the hair root. Okay, so the cause is not on the superficial area, but it is in the dermis, because hair bulb is deep down the dermal part of the skin. So I hope I'm clear till now. Now, we will see what are the common causes of hair fall, which are very common causes of hair fall. Definitely, you have to divide the whole causes into something related to diet, something related to nutrition, something related to hormones, because we have seen hormones affect your hair, right? Your nutrition affects the external environment, the stress, the immune system, everything affects your hair because they are something related to your defense mechanism also. So diseases which affect the thyroid, right? The thyroid imbalances, then high testosterone level. Even in females, if it is very high testosterone level because of PCOD, you have a typical baldness which comes in PCOD, the thinning of hair over the which comes in PCOD, the thinning of hair over the vertex which is visible and the scalp gets visible. So this is because of the hormonal loss, right? Then you have dihydrotestosterone levels which are disrupted, because of which in males you will see they complain that their beard hair do not grow, there is no chest hair, and they also affect the masculinity also. Due to obesity, acanthosis happens, and because of insulin resistance, there is also a disease called as syndrome X or PCOS, where you will see there is a marked insulin resistance with thinning of hair. Okay, then high cortisol level, that is excessive stress. That is what I've talked about, right? So high cortisol indicates that your body is not on the relaxation mode. It is right now fighting with a survival mode, right? So if it is on survival mode, the whole blood is concentrated on the more important organs of your heart, liver, nutrition, everything else. Then you have so many heavy toxic metals. I recently saw a video where it was so severe allergic reaction to the hair dye which so commonly people use that the female had to compromise her life and she went into coma because of that severe allergic reaction which happened because of the chemicals which were used for the hair treatment. You see, so many heavy metals, they cause toxicity. Then there are mites, or there are even you have had louse or something like that, which affects the quality of your hair. Then you have a remedy where you will say like borax, which has got a classical significance, where the typical symptom is that the hair, they stick to each other, right? So this is also a disease of hair only, disease of scalp, where the discharges, they just what we say, the terminology is something related to pee. I'm just skipping. If you get it, please put it on the chat box, right? Then you have so many micronutrient deficiencies like vitamin B12, biotin. This is in trend right now, right? So many people are taking so many nutritions. At the time, they have lack of vitamin B12. They have iron and zinc content, which is very compromised because of the nutrition which they have. We are seeing so many chemicals which are we are intaking, lot of junk food which we are taking, that all affects the micronutrient level, and because the nutrition is compromised, the hair lack that protein. Then definitely an autoimmune cause which affects the hair cycle. Yeah, it is plica polonica. It's a disease condition where the hair strands, they stick to each other because of that typical discharge which is there. So we have to now, because we know the function of the hair, we know the structure of the hair, we know the causes of hair loss, right? So mathematically classifying this hair loss becomes very important, okay? So we are going to understand what alopecia is. So alopecia is where you have some point-shaped places where there is severe hair loss, okay? But this hair loss can go unrecognized. The patient says ki hardly something is left on my scalp. The whole scalp has started becoming visible. That is alopecia incognitia. Then you have areata, where is hair loss from particular areas. Then there is universalis. Okay. In universalis, alopecia universalis spatially is syphilitic condition, because it not only affects the hair of the scalp, but also all the hair all over the body are destroyed. You don't find a single hair even on the eyelashes, eyebrow hair, even the skin appendages in alopecia universalis, like the nails, the fingernails, they also get destroyed. So as you see, alopecia areata, it is still having psychosis, psychosyphilis in it. But when you go to totalis universalis, it is simply syphilitic, frank syphilis. Okay. So types of alopecia we need to see. This is alopecia areata, where there is a loss only from a small area or a patch. Suddenly the patient notices that there is a hair loss which was from this patch, and overnight they say ki, I felt ki this whole area is gone and that is increasing. Then they will find ki few more areas on the scalp which is losing their hair. They get worried and they come to you, right? Then you have alopecia, which is coming because of, this is a typical androgenic alopecia, which runs in families in males. This is more into a family with a history of androgenic alopecia. Friends, when I see androgenic alopecia, I have noticed that when it is at the vertex level, the loss is at the vertex level and there is scarce loss in the front, I still have got results that we are able to prevent the hair loss further. But if it is from this part and the whole area goes, sorry to say, but none of my cases got the result. Then alopecia totalis, yes, the whole hair, it falls down. Then it covers the beard part, right? It not only covers the scalp, but also the beard part. Then it is called as alopecia barbae. Alopecia universalis, as I said, it not only destroys the hair of the scalp, but also from the eyebrows and your eyelashes. Then postpartum alopecia, this is very commonly seen. In olden days, people used to say that after 6th to 7th month of pregnancy, when the uterus is coming back to the normal phase of life, at that time, alopecia is something which happens. There is a tremendous hair loss which is there. One of the reason of this can be, one thing can be like what I should say, the cause can be because of withdrawal of the iron and calcium supplements which the mother has, and because during pregnancy the whole body is in the constructive phase, and after pregnancy when it is returning to the normalcy, at that time whatever the progesterone surge which was there during the pregnancy, it comes to be normal, and therefore there is a postpartum hair loss also. Then cicatricial alopecia is also a similar kind of alopecia areata. Then there is traction alopecia, is because of a constant hair position. Some people have got a tendency to tie their head or their scalp very tightly. So you will find कि जो मांग बनता है उधर से भी you will find hair loss. So this is non-scarring alopecia. Okay. So the basic cause here can be autoimmunity or can be other reasons related to the hormones. Okay. Now moving ahead to the second type of alopecia, that is the scarring alopecia. So scarring alopecia is because of certain autoimmune diseases which affect the hair. And mind you friends, ki when you know ki this is destructive, this is autoimmunity, the destruction is so much to the hair root cell ki it doesn't grow back to normal, and because of the scarring, the hair root is permanently replaced by the scar tissue, and therefore you see lot of hair loss which is happening. So you have lichen because of even because of certain drugs. There is so much of destruction in the hair roots. Then there is fibrosing alopecia. There is silly which causes alopecia. So there can be different reasons because of which there is inflammation at a syphilitic autoimmune inflammation at the attacking the hair root and causing a permanent damage to the tissue. So this is structural irreversible phase of the disease, and therefore there is hair loss which is very gross over here. Now moving ahead to our topic, that is again alopecia areata. So you need to understand how alopecia affects your health. So in healthy condition, what happens ki since they are on the periphery of the body, so they have their own immune system which is happening, which is protecting the body from all the toxins, all the invaders which are trying to destroy the whole immune system. So during a growth stage, this is a perfect balance, and interleukin or the chemical mediators of inflammation, they fight back and they maintain the balance. But what happens when it is in alopecia? Because the T cell, it is why it is called as in autoimmune disease, because there is infiltration by the T cell, and this damaged follicular epithelium activates the natural killer ligands, and therefore the root, the anagen phase, is shifted to the destructive phase of telogen, and the hair cycle which was supposed to last for 2 years, 3 years, 4 years shortens the lifespan, and there is a destruction which happens and no new growth takes place. So there is a constant stress, so there can be a constant expression at the genetic level, because of which the presence of these natural killer cells and T cells which cause a MHC complex, it affects the whole cell cycle, leading to T cell proliferation, and follicular inflammation is under attack because the T cell are getting involved, and therefore we say that this is a phase of disease where it is autoimmunity. T cell maximum times it gives you is an autoimmune, because they fail to identify your own structure or own tissues of the body. So this is overall understanding of the pathophysiology of alopecia. So what can trigger alopecia, right? What can be the causes of alopecia? So definitely a genetic preponderance. Then autoimmune diseases where alopecia areata is very common. and targeted as foreign cells. Then stress, definitely a stress can affect, few infections can affect the alopecia, a fungal infection, even psoriatic eruptions, some bacterial infections can affect the scalp. Then environmental factor, definitely stress plays a very contributory role in development of alopecia, triggering the inflammation, that is autoimmunity, into your body. So when you have a type of alopecia, like in Hindi it is called as undu, they call it as undi. It's just kind of a fungal infection of the scalp, and the discs are very small, round shaped, and they come and they go also. They appear and they disappear also, right? So get a normal hair. Then the patient has to search कि अरे यहाँ पे था, I saw it 8 days back. Now you have got the hair growth. So that is different. Okay, still psora is present in it, right? But when it goes to universalis, it is not psora, it is a complete destruction. Okay. In androgenoid alopecia, I never say ki you will get the hair back, because that is androgenoid baldness and you can stop the further growth, right? So when you talk about the mind and body connection, so as we all know, ki when you define your base based upon the sora, that is the function and the structure. So whatever the disease is affecting the tissue of the body, according to the sensitivity, you will get the signs and symptoms. Okay. So in few cases, you get only scarce hair loss. Few patients come to you, they say, God, doctor, I had so long hair before. Now see, my hair are so much lost that I just have this thin braid now. Then patients say ki we had a good hair growth previously, but after certain disease, my hair growth has got stopped. Then my hair are falling, like my whole room, my whole house is filled with these hair strands, and they are just waving away here and there. I collect my hair every day, seeing, and I feel, oh God, what a great loss I have. And these are the symptoms which come up, right? So they are the reflection of something which is there internally. Okay. So you understand whatever has happened to the interior, that is vital force, is through the external essence of the totality of symptoms. So before entering into any disease, please try to understand what function or the physiology it has got affected. So mind of the cell and mind and body correlation becomes very important for the, not only for the case taking. People ask me, ki, Are, why predictive homeopathy gives so much of importance to this? I tell to them, it is not only to unlock the case or just to take the history in a fancy way or to fancifully explain the case. No, but also to understand ki, yes, this is the sensitivity of this cell at the cellular level, and this sensitivity becomes the ailments from for this disease to happen, or the cure to shift from the health to the disease phase. So, friends, I will say ki the mind can be deceitful. The person can hide the things from you, but the symptoms are reflection of the mind. Nothing goes unnoticed if you are a true observer, and body is the real window to enter inside the mind. So the finer you understand the symptoms, the journey of disease, what was the first symptom is very important. Like in diabetes, right? Everyone says that diabetes is need of love. I will always say ki no, before labeling it need of love, try to understand which was the presenting symptom. That is individualization, right? Because every diabetic will not have a diabetic foot or a delayed healing of wound. It can be a UTI, it can be a tremendously high diabetes, but not even giving symptoms. So therefore, you have to understand the whole PQRS or the totality based on this mind and body connection. So understand the pathology. Is it in which stage of the disease the patient has come to you? Is it physiology? It's pathology, or it is structural changes, that is psora, it is into adaptive phase, that is sycosis, or it has gone into that stage of destruction or syphilis. If you know this in totality, then understand the process through which the task has happened. Example, sir would always say कि result आपके सामने है, बट वो पर्सन ने किस ट्रैक को अपनाया या किस गाड़ी में वो बैठ के आया इज ऑल्सो इम्पॉर्टेंट टू डिसाइड. So what is the pathophysiology which has got affected in your case? And definitely nothing goes without a miasmatic understanding and without correlating the miasm or the stage of disease. Okay, so these are the key to analysis. And definitely what Hahnemann sir says ki in totality whatever I have talked in the previous slide is a summary of this aphorism number 189, that whatever is going inside externally, whatever is being shown is a reflection, because without some internal cause, without cooperation of the whole organism, nothing is reflected on the body. So therefore, body is the window to whatever is happening inside. So body chikke bol, I want help. All the signs and symptoms are just screaming and shouting that I need help. So you just have to be patient, listen to each and every symptom and analyze calmly. So in a footnote 9, it is well said that this is applicable to more of the syphilitic or any diseases, because without any ailments from, there can never be a disease. So most severe disease may be produced by disturbance of the vital force through the imagination. So there is certain problem in the perception of that individual. There is certain problem in how the person is seeing the world, and therefore the whole disease process occurs. And if you want to cure, what sir says ki those imagination should be taken into consideration, and therefore we give importance to all the destructive or syphilitic mentals, right? The syphilitic symptoms in our prescription. Okay. So now understand hair. So as we know that hair has got lot of role in protection and communication. As I said before, how it protects, it plays an important role in insulation, thermoregulation. It is a sign of communication, presenting yourself in the society, how you communicate without the words, right? Then it has serves as an antenna, right? It is called as antenna also because as you all knew ki Brahmins, they never cut off their hair, right? They feel that this is their basic root of the ancestors. Even we have got a culture that when some ancestor they die, you lose your parents, right? You lose something of your inheritance, so you cut your hair, because this is also a loyalty, what you say, that it is a samarpan what we have, because we have got connections through the ancestors. Okay, then one more important thing is ki if you have seen military people, soldiers, they cut their hair. Saints, they cut their hair because it is a indication that they have completely devoted themselves and they have surrendered their loyalty towards the clan, what they say, or they have surrendered themselves to the authority. And before it was like very strict. You should have a certain way of dressing your hair. Okay. Then it is a symbol of strength. Yes, it is a symbol of strength. I said ki before in olden days, if you see, all the Raja Maharajas used to have good thick hair, good beard, and a very hairy body, and they would show their strength and stamina. A good hair strength, they matlab, it is shown in movies also, Indian movies, that when people are tortured, their hair are being pulled, and even if they are so strong-willed, they don't give away their hair, give them that strength to bear that torture, that pressure. It also symbolizes freedom and power, right? As I said, ki because it talks about strength, it talks about freedom, it talks about the power, it talks about certain adding value to yourself. Okay, so definitely we also had discussed about the sexual identity through the hair and the social purpose it plays in communicating, because female, it is seductive also. Okay, the more masculine, they are more hairy. The more feminine, they have beautiful hair growth in them. So they talk about seduction and physical strength. Then, as I said, when someone dies in India, we have a culture that we just braid out the hair and shave it completely. And even in the devotions in certain temples, we just go and remove all the hair and give a samarpan, a surrender to our personality. So even to the soul level. So if you see in hair, you will see a lot of terminologies which are coming up. Now you are getting into the core of the whole hair. Ki what is the function and what is the purpose that hair has come. It also plays a very good role in intuitive capacity. So it is image of self-identity, is a projection of individuality. It also projects our identity. Why? Because everyone doesn't have the same hair. Even in the family, it is not possible ki if mother has got such an hair, so child will also have. So it identifies also, it defines your personality. It is a carrier of your memories of the past also. So therefore, it is given so much of importance. So coming to that crux of the whole session is ki when you want to unlock any emotional pathology. Now, this is what the psora or the physiology or function of the hair is, right? If you understand from the books of anatomy, where the hair are present, then what is the function, and even understanding to the higher level what physiology and what psychosocial roles a tissue has to play inside the body and outside the world also, right? And how it is giving connection between the world and inside of yourself. So whenever a disease will happen, okay? So whenever a disease will happen, it will disrupt this sora, okay? Because every disease starts from inflammation, starts from sora. So if these values of any structure, if the function of this structure goes on compromising, at that time a syphilis or psychosis begins. Am I very clear to this point? Because everyone keeps on asking what is the emotional pathology of this disease or that disease, and I always say, please understand what is the structure, what is the physiology, what is the function this tissue is playing a role in the whole body. So it is not only identity, it is not only a connective tissue, but it also has a sexual identity, right? It has got a metabolic role also, because showing that everything is in good health, right? It is also showing a connection between you and your ancestors, your father. Your whole world is getting connected. You get connected through this to your partner also, right? So when you see the diseases where hair comes in, okay? So when hair comes in, there will be so many things which will fall into play, right? So don't say it is only devaluation, okay? Don't say it is only identity crisis. The individualization is here when you understand the disease in complete totality. Am I very clear to this point? Because every tissue has got its role to play, has got its function to play, and whenever this function is, this physiology or this sora is affected, then the gear will shift from psychosis to syphilis. Now connecting the whole lecture what we had in the past, right? Today. So here it comes that whenever you're talking about hair, it is the connection, it is identity, it is the value system, it is you yourself. Okay. So therefore, when you see androgenite baldness, you see it is hitting not only the scalp but also the individual testosterone level of the body. When you see PCOD, you see there is baldness which is coming because of lot of testosterone which is coming inside. So again, a hormonal display because of some identity crisis. Okay. When you see psoriasis, it is because of not only because of certain rejection but also failures, because it is again a built up. Then you see autoimmune diseases, so it has to be certain devaluation which is coming up to your level. You are punishing yourself, right? So everything has to be defined on the basis of psora, psychosis, and syphilis, and connect those ends and see the totality coming in front of you. You will imagine it's a mathematics, right? It's a beautiful science of mathematics. So if it comes to hair loss, now we have already taken hair loss, okay? So now tell me, you all tell me what will be the reasons for hair loss, because we saw the physiology of hair, the connections the hair has. So now what will be the reasons for hair loss? So hair loss is not in the present, okay? Hair, as we have seen, the whole hair cycle is not of 1 or 2 days, right? It is of years. The anagen phase is of years, right? The telogen takes time to come. So when you're talking about hair, please go in the past and dig up in the past, because the cause is in the past. So hair cut is again a voluntarily submission to the authority. So submissiveness, okay? Devaluation, then timidity, then person gets away. It's a thermoregulatory mechanism. So protection. So person wants to get rid of that protection. So too much of protection in the body, too much of restriction, I would say, right? You cannot do this, you cannot do that. If you remember, in the past days when it was a widow, right? Because it was a sign of femininity, the widows were not asked to have hair long growth. They were asked कि you should bald your hair, and they were so much insecure in the society that they had to rid out of that whole protective society and get rid of these hair so that they feel protected, because they were being identified that you are a widow, you have lost your partner. Okay, so it is not only a loss, but it is also a loss, a separation conflict will also come over here, right? So there is so much of fear and insecurities, like in PCOD, you will see there is so much of fear and insecurities towards the past. They don't feel secured in the male society, and femininity conflicts come up. So there is so much of fear and insecurities you will see in all the cases who are coming with hair loss, because they feel that they are not secure. So they want to get rid of the protected shield, and they lose what they want. They lose because I feel insecure, I have fear of starvation in the future, so better something which will take my energy ahead, let me cut it down. What happens in nutritional deficiency? This happens, right? Then I cannot be myself. What I said, ki, I am a beautiful girl. I want to live like a girl. I want to be a masculine person. But my identity is at stake. I cannot be myself. Therefore, I have to get rid of this. So my body throws out the hair. Then I was deeply in connection with my family, with my loved ones. When you hug someone, you cuddle a pet, a dog, or something, you feel the fluffy and the fairy part, you feel the smoothness of the skin. So everything, you feel that connection with your family, right? So whenever you feel separated from the family, that is a separation conflict, you get a hair loss. You are not being recognized for what you're doing in your work. So you feel again being devalued. You feel being insulted, humiliated, mortified. That is what will give you all loss, conflicts, and loss of protection and feeling of separate from protection. Then you feel that you are not being identified what you are, and you feel that you are isolated from the world, and whatever. There is a rubric, delusion, misunderstood, she is. And the only remedy over here is Ignatia, right? Because of getting into that grief phase, she goes into that phase that I am alone in this world. CPR is a beautiful remedy for menopausal women. Why? Because at the menopausal age, they lose their whole identity of femininity, all the feminine complexes, effeminity, they will all go into identity conflicts and producing alopecia or producing hair loss, which is very severe. Then, in spite of giving so much to the family, in spite of giving so much to the relationship, they feel that they are not being recognized, they are not being appreciated, they are not being valued, right? And this devaluation of not being recognized also gives you hair loss. Then, since this is also an empowerment, right? I said a lot of People recognize themselves with the strength they have with beautiful hair, because hair signifies power. So if you fear of losing strength, then you lose your hair, right? So this is power, empowerment. Then lost my roots. When I feel that I was so much attached to my roots, I wanted to be grounded. All my ancestors have blessed me so much, and when I feel that I've lost that connection with them, I've lost my home, I've lost my family, I have so much of financial crisis that I have to leave so many things. At that time, I have lost all my roots. So when losing something is not irrational, but this losing something can be like post divorce. Okay, many girls come to us that have lost interest into the world because I lost my life, I lost my love, I was so much attached to that person. So that separation conflict is also over here because they have lost something. This can be a relationship, this can be an individual, it can be death, it can be grief, it can be disappointment of love, everything, because then they lose interest into themselves also. So that death desire, or when you feel that now my life is at the full stressful phase, I cannot survive. So that will also give you a hair loss. So towards something or someone, disgust feeling, definitely stuck, is not able to communicate, because hair is for communication also. If I have good hair length, I will try to communicate. And it's like in animals, if you say ki, if they have got those colors, in birds they have reflection of colors which is coming from the hair strands, so they invite their mates that we are ready to be presented. So because in today's world, as we have seen all the conflicts of PCOD, PCOS, where the femininity is at stake, where they become more masculine and they're losing their identity and they want to control everything in the world. And they say ki we are just running in the competition of this male society, and I cannot trust what the life has given to me. And being a female also, I don't want this identity, and I just want to lose this identity. And therefore, you see alopecia in these females also. Am I very clear till now? If any doubt, we can take these slides again, because this is very important. I think there is a lot of repetition because I wanted to give it you the thought that how a tissue is related to the structure, to the function, how physiology gets affected, and how the emotional pathology hits the certain tissue, because this tissue's function or the sensitivity is hit, and therefore a person suffers from certain pathology or certain disease. Okay. So going ahead to the rubric part. Okay. Everyone wants this part. Okay. So when you come with alopecia, don't just take it on the superficial level. Okay. So even your parts of your head or the scalp, or which area of hair loss the person has, will also indicate something. Okay. So if it is a nape of neck that is on the back side, you will see that there is loss of protection. There is a lot of insecurity. When you see a neck, you say that this is a support structure. Okay. You give support to your head and the neck when you support the nape of the neck. So whenever you feel insecure, there is loss of protection, it is nape of neck. Then you have this vertex part, that is your head. So anything which is the highest authority. So when you have the problems with the authority, that is the head of the family, and you want to just feel that I've lost the controls and I hide my fear, so the head gets. So even you see that before, what used to happen is ki father's father, grandfather, they used to rule, right? There used to be grandfather on with whom, under whom the father used to work, then under whom the son used to work. So there used to be a surrender in front of them ki okay, I have to surrender, I cannot fight back to my grandfather, I have to listen. This is what is going into hierarchy. So this is what hierarchy comes up. So this is head or the vertex part. Then you have temporofrontal part. This is the part which gets affected. So because this part of the brain is involved with intellect, we think like this, right? So when I think that lot of cares and worries are there in the life, and I feel that I overthink, I'm not able to analyze the situation it as it has to come up. So you start having this hair loss. Now, hair and hair diseases do not end over here. You have so many other problems also which are related to the hair. So people come up with, I had a case where she used to just pluck her hair to the level she should not leave the hair. She used to just scratch it or just hold it so hard and grasp it so badly that it was like difficult to for the mother also of the child, and also the child, it was very difficult to take over the hand. So therefore the thing is, if a person is plucking the hair, there is a devaluation which is very deep and unable to grasp things over my head. That means I don't understand what is happening around. So I just वो बोलते ना, when I don't understand anything which is happening, I just scratch my head. So what that scratch my head is plucking my head. Okay. Then gray hair. So if it is gray hair, so gray hair is like wisdom. Okay. Before people used to follow this path, like if they had a single gray hair stand, they would just leave everything in their life, and after 60 years they used to have graying of hair, and that was a sign of wisdom that हमारा तीसरा life का and we should get separated and go for the search of knowledge and the true wisdom. In Maslow theory, you have seen, right? Self-actualization, which is in the top of the thing. So premature graying of hair is when you will find that their true purpose, their self-actualization or the knowledge is getting affected. And if in children you get too mature, too premature gray hair, then the conflict is in the mother's womb. Please go and identify that. This I have not yet able to unlock so well in gray hair, or I will say only one case I had in my life where I could really revert the process only in one case, but that unfortunately that case at that time there was no feasible camera, so I could not document it. But only one case I had, and that was a child with precocity, I would say. And yes, the child behaved in a very early age also like an elderly. At that time, I was too premature to prescribe, so I prescribed carcinosin based on the totality. And yes, I got the result. Then another is dandruff. So dandruff is what? It is scaling of the scalp, which is a separation conflict with a sense of injustice. You will find if it is lack of recognition of the father, absent father, father is very indifferent, castrating, or who devalues us, then it will be dandruff with hair fall. Then people who have low self-esteem and need recognition, brittle hair. So then it is a sign of nutrition. So you feel that your grounds, you are not having an optimum nutritional value. So you are not internally strong enough. Okay. So deep internal references that you're not solid enough. So you have brittle hair. Okay. So dryness is like a personality who has lack of emotions, very cold emotionally. So that is what dryness of hair will be. And even oily hair is, few people have got too much of oily scalp and too much of oily skin. As I have understood, it is too much of sebaceous gland which is being secreted. So this is what is because they are too slippery. They don't want to hold on the things and they just want to get rid. Usually, I have seen that too much of oily skin is correlated with something like lazy people, I think. They are very indolent kind of people, you will say. You have so many people who are very dull and they just have lack of energies. So then, now, the whole crux of this whole story ends up here is that we will again classify this whole structure of hair loss or hair fall into three categories again. Now, when it comes to three things, the first thing is devaluation, or when you talk about identity. See, hair is for identity, hair is for connection, hair is for sexual identity, hair is for my value system. Hair will define your whole value, adds value to your personality. So again, when you have a conflict that you look at yourself that I'm worthless, I have failed in my life. I don't do good enough into my life. So all the rubrics of devaluation or identity will come. Can anyone help me over here and be interactive? What rubrics can come for here for hair loss? Because we are in the process, right? I don't want to just give you the list over here, but please, can you churn your brain, scratch your head without pulling your scalp, and help me out with rubrics which can come up over here, which will define devaluation and identity of hair fall. Come on, let's be very interactive. Embarrassment, identity loss. Yes, identity loss will come over here. Delusion, small he is. Very good. It's a devaluation conflict. Then more, I'm so happy if people come up with so much of interactions because it gives a boost. So confusion of identity, delusion, worthless, very good. Confusion, identity, head separated from the body, head belongs to others. Yes, definitely. Estranged from the family will not come in the devaluation. Deserted, forsaken will not come in devaluation. Reproaches himself, delusion, identity will come over here. Abandoned will not come over here. I'm so happy you all are getting so active. But please identify that we are right now identifying identity conflicts, right? So wherever the hair plays an important role in identity of the person, that we have to find out. So what will be the rubrics for devaluation? Come on. Devaluation, not about connection. I'm not talking about any connection. I'm talking about devaluation, confusion of identity, self-reproach is the basic rubric which we'll get. Okay? Yes, self-reproach. Yes, definitely self-reproach is something related to autoimmunity also. Mortification, yes, insult, mortification. It will again hit the position of the person, the value system. Okay? So delusion, he's worthless. Delusion, despised by others. He's being criticized. I'm not being valued for whatever I'm working. Everyone is finding a fault in me. You know? Then I'm not being appreciated in this world. Whatever work I'm doing is my identity. People should know my worth, but everyone fails to identify me. I'm just fighting this identity and I'm not being appreciated. Ailments from mortification, ailments from humiliation, indignation, injustice. I'm not being valued for whatever I've been done. No appreciation. Forget of appreciation. Whatever I needed was given to the other person. Sensitive, a high sensitivity of criticism, a high sensitivity to reprimands. Even a single admonition will aggravate. Okay? So confidence, want of, confusion, identity of. So these are the rubrics which will come over here. Okay? Which will again define an identity or a value conflict. Delusion, small. Delusion, I'm worthless. Delusion, so many things related to me and mine. Do you all agree to what we have come to as a conclusion? So whenever in cases it is a valuation, yes, confidence low, confidence want off. Will weakness will also come over here. Okay. So this will all come under value system because here it gives value to you. So now please do as a homework and go and see the rubrics which will come for the identity crisis or somewhere you are not being valued. Okay. So I'm worthless. I'm not good enough. I have failed. Now I will take a case based upon this. Okay. So this is a case of a person who had come to me at the age of 14 to 15 years and he came to me with alopecia and he said ki one fine morning my mother noticed that there was a huge hair loss and the hair loss started from the occipital area and the person says ki whenever I go to the sun heat I feel that my scalp has started burning and it has become sensitive scalp. Okay. Then there is recurrent coryza. Okay. So now you say, I have given you a glimpse that whenever it is a nape of neck, the hair loss is from the nape of neck. So it is related to identity and insecurities, right? So he is short stature. He is one of the twin child who was born prematurely and the other child died after birth. The other sibling died after birth. The person was not even aware of this. So the history goes that he's born and brought up in a middle class family. Now, before we take a history, this is predictive homeopathy. Since it is 1 plus 1 is 2. So if it is occipital, it is alopecia areata, what you will find in the history. It has to be either devaluation or something related to connection, right? So here, because it is alopecia in a year male, this slide you want, right? And a short stature person. So everything will speak of something which is very significant. You cannot miss anything, right? So short stature, again, anything, right? So short stature, again, talks about some insecurities. Why the body is not growing, why the body is losing, right? Why the body has not attained a full height. Okay. So he is a lean, thin, short statured and a slow person. And he says, "Ki, I'm an introvert, not have many friends. I like not to mix with many people because I feel that I am not having that confidence of mixing with people. I have very few friends, and I always had a craving that I should have some sibling because I have that loneliness which is running inside me, and that loneliness is really killing me inside. And I want that I should have a support in the family with whom I can share things and I can talk to them. Because in my family, I have my father, my mother. My father is always busy in certain work. I don't know the whole work, but he works as an engineer, and he has certain house work, so he's completely busy. I don't have so much of confidence, so I hardly participate in school. I'm good in studies, but more into my comfort zone at home. So he said ki even in COVID, it did not affect me staying back at home because I was always a homely person. And he said ki when my family went into COVID, I was really very scared, and I had to face a lot of loneliness at that time because my parents were also not available. I am very friendly to my father and I share everything with him. I am very good in studies according to me. When my father says I am an average student because I am good at maths but not so good in science. He scored 84 percentage in 9th standard. He is a mild person. Then I asked him कि how is your behavior? तो he said कि I'm like cartoon type का मजाक वाला. गुस्सा भी हो जाए तो मजाक में गुस्सा हो गए, मजाक में मान गए. I don't take it to the heart. I never fight back. My friends tease me a lot and they connect me to some girl, which I don't like actually. But you know what? I don't retaliate to them. I don't fight back to them. I just keep quiet at that time and I come home. I have the desire that I should get violent and just hit him on the nose. So what he said is कि इच्छा होती है उसके नाक में मारूं, है ना? But have you ever done that? No, I cannot fight back. I never did that. I just come back home and not express myself. I have to calm myself and I'm just consolable. I have that fear that if I do some mischief in the school, my teacher will complain to my parents and I will be punished. And I don't want that my parents should have a wrong image about me. And I should have a good image at home also. I'm an obedient boy and I try to adapt to whatever situation is it. And every day I feel that I should improve and perform and my personality should grow. Okay. I always feel that I am too timid to adapt to the change and I cannot handle the situations. And my father says also that I am very slow. So as I am a single child, so father is thoda sa strict, but I like sharing to him. I whenever they scold me, I still cry or I just keep quiet. I'm not much organized. I am slow in everything, hence get scolded ki you are getting late for every now and then. My father has got good speed. I'm not that responsible, my father says, and I don't take a helping hand to him. So, Dr. Saab, then he started talking like a child. Ki, I have anxiety for my hair loss. You know, it is so important for my personality, and I already lose that personality. मेरी height तो बढ़ जाएगी ना. और मुझे बहुत लोनली भी फील होता है, ऊपर से बाल भी चले जाएंगे तो विल आई गेट रिजेक्शन और व्हाट विल हैपन, इट विल अफेक्ट नॉट रिजेक्शन, ही सेड इट वाज मोर ऑफ पर्सनालिटी. So I want to try, I want that I should grow. I listen to audios which talk about the personality development and I want to improve day by day on myself. try to help my mother. Parents say I'm not active, and I always blame myself and want to improve self. I always have that pressure built up by my parents of scoring well in my exams, and therefore every time when it is an exam, he gets some acute episode, some fever or something, and he falls sick, and his exams performance gets down. And I'm very less right, so I'm very conscious, and I just want to do everything which should grow. So parents said that when he was very small, we used to tell him to do these physical activities and grow and go out of home, run, but he would never do that. And now he wants. In fifth standard, he proposed a girl, and can you imagine? She rejected, obviously. And after that, he said, we are in the same class, but we never have eye contact with each other, and I always feel conscious in front of her, but after that I never dared to talk to her. But that pinch of that proposal, that feeling is still in my heart, and I never shared it with anyone. So I'm a person who will keep things into my heart. So it was my mistake, I agree, and whenever it is my mistake, I just keep it to myself, and stop talking to her. I said sorry, and I said, I even feel till now that I lack something, therefore she must have rejected me. So that fear of rejection, that devaluation is there. So you see, this child is introvert, loneliness, company desire, sensitive to reprimands, confidence is poor. There is so much of self-evaluation. There is reproaching himself because every time he says, it is my mistake, I lack this, I lack that, and I have so many negative things in me. I have so less height. I don't have that daring. I'm slow. And I don't work so hard. I lack that energy to perform. So that is so much of a reproaching self. That is weak-willed, obedient child, mild and submissive, timid, anger suppressed, anticipatory anxiety, introvert and reserved. So to you people, I'll tell you, this is the analysis of devaluation conflict. In this case, to be very honest, I will say whatever I'm presenting to you is that what committed mistakes I had, right? What I did not give importance to the Sora, है ना? Then we also took mother's pregnancy history in this case, which I have not mentioned over here, that she also had this crisis of being lonely in the family because they are Bengalis, but they had to somehow stay at Hyderabad for their bread and butter. Okay. So for their bread and butter, since they were staying in Hyderabad, this lady felt very lonely. Okay. So throughout her pregnancy, she was lonely. And when she came to know that she has twin pregnancy, she got a bit anxious because there was no support of the family also. Same feeling is being transferred to the child. And the child who had got a sibling since birth, since the progeny, right? Not progeny, since her womb life, they had a company, right? And he was not aware that he doesn't have, he lost his sibling, never revealed. During the case taking part, he got to know he had a sibling who did not survive the birth process. So can you imagine that process, that thought of having a company, that loneliness is there inside? So what I felt is, I was very honest to you people. I felt yeah, very clear. The case is so clear. It is timid. It is low confidence. It is a remedy which has got low self-esteem, confidence poor. So prescribe now. Remedy. Can anyone come up with a remedy? Is it not devaluation? Do you all agree to devaluation? Do you agree to the whole devaluation conflict? We have studied the rubrics which are coming up, and we can understand through the whole history that there is only devaluation which is coming up. Okay. So you all also come up with the prescription. What I did, I prescribed in Calcaria first. But was everything went wrong, in wrong direction. Why in wrong direction? I will give you that explanation also. Because after giving the remedy, if it is a right direction, at least the hair of more important areas should not fall down. Before the child came to me, the hair fall was from the occipital area and one area was there. But once I gave the remedy, the size started increasing and new patches started appear. And then there was a okay, the eyes protection is more important. So eyebrow and lashes should not go. Okay. Then Again, what we do is we just go around and around. Chalo, kal ke ya FOS ne kaam kiya, to let us try with. He is an anxious person who gets sick in the. I saw that he is diligent person, obedient, timid, anticipatory anxiety. I gave him silly. But what happened is again new symptoms appeared which was not there, and the symptom was that there was eye condition. Okay, I am a prescriber. I don't prescribe so oftenly. My best prescription is my SL World. So I wait. Even if it is a wrong direction, that time I was really very scared, because now what happened is the father started building that pressure. That mounting pressure started coming upon me कि ये नया पैच क्यों आ गया. Every time the parent will come, ये नया पैच तो नहीं आना चाहिए था, ऐसा तो नहीं होना चाहिए था, कम तो नहीं हुआ. Then again, in that pressure, what he said is कि we will leave you. We are not able to give cure. Please be honest and we will change the doctor. And I was like, my God, this is an introvert person. Again, calcarea has not worked, silicia has not worked. So let me check out with her personality, and I gave natrum card 10. But to my amaze, again, it was a wrong prescription. Patches reduced, but eyelashes also reduced further, and the mustaches started going, which was not there before, you know. And there was an incident in the family that sister's health was not good, so he got very anxious, and he even left his 10 marks paper in his boards, and he did not attempt it. Feeling that I'm too weak, I again reviewed the totality. He still watches cartoons, he's childish, he's all this. So I gave him natrum carb on this basis. So you will see this was the picture over there. Even though if you have alopecia and you find hair which are coming up, but if there is hair loss which is from the eyebrow and the eyelashes, it is a wrong direction. So it gave me like a goosebump. Now what to do? Okay. So again, I reviewed the totality. See, after giving natrum carb also, the remedy was not wrong, right? I tried silicia, I tried calcarea FOS. The hair was just going. There was hair loss on the beard part also. And then there is a hair loss of the mustaches and the beard also. And the doctor, he was happy. बोले डॉक्टर आईब्रो के बाल आने लगे, मुस्टैचेस के चले गए. Is it right? No, it is not right. Because what happened is कि eyebrow के बाल आए, but eyelashes के बाल नहीं आए. If it is a right remedy, then eyelashes should also come equally with the eyebrow, and this should have not gone. So he got such a bad face that one side was completely, and I asked him कि अरे पूरा shave कर ले. बोले no, वैसे ही बहुत मुश्किल से आ रहे हैं और वो भी चले जाएंगे. I don't want to shave. So we reviewed the whole totality, and you see the progress. We reviewed, we gave a right remedy, and after this right remedy, I took so long time. Can you change see the check with the dates? This is April 25, so you don't have this eyebrow lashes, eyelashes chale gaye, and this whole part became smooth. So this is in April 25. Then this is in 7th month of 25. See the progress of the disease. Then what came up is we tried to give a right remedy, and after that the eyelashes started coming up. This was the left eyelashes which came up. Equally, the eyebrow lashes also came up, and the beard which was lost which came up, and even the mustaches started growing bushy. Okay, this is in 25. Then 12th month 25, this is where the progress has started. He had one patch which came up here on the face. Then yeah, this is 26. So in 26, he has got mustaches which are very clear. This is in February. Sorry, it is not February, I think. This is not 26. This is in 25 only, but around November. Because now he has got a very clear face. His mustaches are very well. It's a mistake probably, because this is where the pimples had also come up. And see, the beard has become very bushy now, and mustaches have completely come up. In 26, it is very normal, and even the scalp has come up. So we reviewed the whole totality and working on the principle that we have to search the devaluation conflict, the totality which I reviewed. See, this is 25 only. So that date is wrong. So in 25, we reviewed the whole totality, and we came to know this is confidence, want of, reproaches himself, sensitive to reprimand, and forsaken feeling, because he had got a strong sense of feeling that he wanted company. He was reserved, he was timid, he was a very sensitive fellow who was very conscientious also, but a non-diligent because he was very slow in that sense that he would not take up responsibilities, and timid also. Calcarea had failed to give the result. Natramkar was not the right remedy. Pulsatilla, he's not a pulsatilla personality. He is not Cilicia also because we have already given. Even in between, I think I had tried with Lycopodium also, but this did not work. So these are the remedies which were given. Then after reviewing the whole totality, Natrum tenem was given to the patient. And once the Natrum tenem was given, you see, this is the whole journey of the case which I have told you. And this is today's picture yesterday, probably this month when he came for the follow-up. We cannot reveal the face, so it's just the eyebrows. Everything is absolutely normal. He has got now a bushy mustache and a bushy beard. Moral of the story in this case is that when you fall in the pit, you should understand what is the devaluation, which is the most tool on which we have to ground ourselves. Is it separation or it is devaluation? Okay. So there is a deep down devaluation conflict which is running in the family. In this person, he is low confident and he is always blaming himself for whatever things are done. He never said and fought with others. So he has lack of confidence also. So today now I want to give you a message. If you are very sorry in your prescription now, you don't understand anything, then just stand on your roots. Take the will, moral, intellect wala part. Understand what is the conflict in the whole case. So the conflict was his own confidence, which was at stake. He was not confident about his height. He was reproaching himself for having he was anxious also. He was sensitive that I should not be punished. He had that whole feeling of loneliness and deserted feeling that I am left alone and I want company, desire company, which was very strictly there. But when you take syphilis, don't take desires. Go and take it in an opposite way. So if a person has the desire of company, don't take just company desire. Go to the opposite end because it is syphilis, okay? So the basic need was to have a company. So there is a difference between neglection and foresight. Very fast, very fine difference. How do you differentiate these two things? Because when you talk about forsaken feeling, that taint of love comes in. Okay. So the need of a forsaken person is love. Okay. When you talk about neglected, the need of the person is esteem. How can you ignore me? How could you neglect me, right? But here the thing was, I wanted to share, I wanted to give my love to someone. Therefore, I wanted a sibling. He was destined from the world, from the universe to have a twin baby. But somewhere he lost that. And imagine, till 14 years, he was not even aware that he had a sibling. But that longingness of company has been always there. So, taking that psora, I selected Natramute and Natramute 10M. Beautifully, it has covered. And imagine that threatening call from the father woke me up. And I was like, oh my God, now you cannot commit a mistake. You have to be a good prescriber in this case, or else you will leave this patient. Because of this, I just went into my grounds. I searched everything. He was reserved, everything was matching. He had disappointment, he had that rejection feeling also, and he was at that age where he wanted emotionally his personality to grow. And since calcarea had not worked, so what was the psora was that confidence which was lacking throughout and through, in this case, with reproaching himself, covering the autoimmunity part, and therefore natramute gave beautiful result. I've shared the picture. Now getting into, I think devaluation is very clear. Any doubts with devaluation? The pillar of devaluation is very clear. Yeah, he wanted that company, probably, therefore he had just attracted a girl, but where also he failed. So he is he feels that he is not being successful, but he has never uttered somewhere that I'm a failure. He says, I'm trying my best. So now going to the second conflict. When we move to the second conflict, okay, since we had devaluation is very important. The same way, yeah. Now understand The pillars, the tripod for alopecia is devaluation. Separation is the second pillar on which alopecia can be defined. So the separation conflict is I have lost someone. This is evaluation. I have lost someone. I'm emotionally disconnected. I'm not held anymore. This will be the base of separation conflict. Like it can be a divorce, it can be a relationship crisis, it can be something like I was deeply attached to. It can be somewhere I've given my heart to. I was connected to. So I feel that I'm emotionally disconnected and I am not being like we took care as being rooted. Okay, somewhere I was connected to my roots. So when I'm uprooted from my family, like just going away from the family, staying alone in the hostels, getting divorced from your loved ones, and getting separated, it can be a brutal separation, someone dying. So please come up with the rubrics. I want the group to churn yourself now. No academic work. Let's get interactive, friends. So something related to disconnection, something related to separation conflicts. What will be the rubrics? Yes, abandonment, disappointment in love, alone in the world, estranged. Again, forsaken will come, lonely will come because it's separation, right? Separation from self, separation from the other world, estranged, very beautiful. Delusion, deserted, wonderful. These are the rubrics will definitely come for the separation conflict. Okay. So ailments from separation. Okay. Ailments from loss of loved ones. Ailments, grief from loss of relatives. Delusion, forsaken feeling. Delusion, deserted. Fear, being alone. Delusion, neglected. Is it not separation, neglection? Yes, it is esteem, but neglection, definitely neglected. Delusion, friendless. I have no one. Clinging, yes, it will come because it is also syphilitic. Delusion, cast away, yes. Delusion, estranged, forsaken, definitely. Ailments from disappointment, yes, it will come up because they all are rubrics for separation. Alone in the world I am. Indifference to loved ones. Indifference is also syphilitic separation. Though I have family, I feel indifferent. This is also separation. Though I have everyone, I don't feel that love, that connection to them. I feel that I'm disconnected to them emotionally. Emotional, cold feeling, right? Having no emotions. That brutality is also separation. Misanthropy is also separation from this world. I'm not mentioned in the list, but misanthropy will also come where you feel being disconnected to the whole humankind. Soul separation. I feel I'm very misfortunate, unfortunate feeling because I feel I'm being disconnected to the world. Okay, so these are the separation rubrics which you will find. So I'm being persecuted. Whole my family, which was supposed to be my strength, is persecuting me. It's just running behind me. They are trying to just harm me and neglect me. So they feel being neglected, being lost, disconnected. Okay. So now let's take a case. Are you okay with it? See, this is not given in any book. This is through experience and through the understanding of whatever I have of diseases and the various cases which I have studied. I see to it कि in each case the pathology is connected to that deeper level and we redefine everything. Any problem or doubt, you can put it in the chat box. I'm going ahead with the case number 2. That this case number 2 was way back, long back. So I don't have any proofs for it. This is a female who came to me with alopecia areata. Important thing is the alopecia started from the occipital area, but there was a big patch on the vertex now. The occipital area was very small when she came to me, but there was a huge patch which was covering the whole occipital area. And she said कि मेरा अभी चोटी भी इतना पतला हो गया है. And when she just opened her scalp and I could see like a cap, the whole occipital area patch was gone. So started with extensive hair fall. She said कि I have uterine fibroids. So doctor says ki there are lot many hormonal changes, and because of which I have underwent lot of hormonal treatment. And doctor since 1 year ये तो बढ़ता ही जा रहा है, और अब तो मुझे लगता है कि मेरे बाल भी नहीं बचेंगे. Now this is the last hope I'm coming to you and saying that I've heard that homeopathy will work for it, and now you're the last hope because I've spent thousands of money and nothing is helping me out. I've tried with all medications, all the multivitamins have not helped me. So will this treatment help me out? So she was again in a doubt. She was asking so many questions. I still remember this case clear into my memories. That the way she presented to me, she was talking, and she said ki I had an abortion before, and after that so much of weakness is there. Doctors have been prescribing so many medicines, but still I'm never well after that. She has a frequent tendency of epistaxis and hematemesis noted in the early childhood. She also narrated during her case was that she was very fair complexion and a beautiful lady. And what happened was that she had underwent some injury, or she could not remember, but बोले मुझे बहुत ज्यादा nose bleed हुआ. And after that nose bleed, what happened is because of that nose bleed, my blood loss was so severe that after that my complexion has also gone, and even I had vomiting of blood. So even during pregnancy I had that uterine bleedings and hemorrhages, and I have this tendency of bleeding. So during she also had a previous of history of electric shock, and because of that shock she had an abortion. She had typhoid, she had so many matlab she had chikungunya also, and she had fevers frequently, for which she was being treated. She said ki, she has dreams of prophesying and a clairvoyant dream. She said ki always I see something and I can sense it. If I see a dead body, there will be some dead happening into my neighbors or into the family. Then I frequently have snakes in my dreams, especially during the pregnancy I had. I will start feeling uneasy. I can feel the energies. And if there is some change in my energy level, something bad will happen. If I see a dream where I'm very happy, then something wrong will happen. I'm so sure something wrong will happen. If I see a dream that something bad has happened, food is there, then something bad is going to happen. I'm so sure about it. But there was no clear cut vision which was there. She's only said ki when my father was not well, I was sensing that my father will not be better or something like that. Time he fallen sick. So this was something which he described. So there was bleeding during pregnancy also. And she said ki during pregnancy, before 8 days, I started feeling uneasy, bleeding na ho jaye, and then I had this bleeding episode for which I was being admitted. Then she has negative incidences which occur around her, and she said कि I'm very emotional person, मेरे को बहुत जल्दी भावनाएं समझ जाती है, and I get very restless, angry over trifles. मेरे को ना बहुत साफ सफाई की जरूरत है, and I am very organized. मेरी जिठानी is not working so much, she is not organized at all, she will throw things here and there which really provokes anger in me. And she started talking, I am like this, I am like that. She was very lean thin personality, not even attractive, but she was continuously talking. I feel angry, I feel that I'm very right, and everyone should support me. I get very furious when my co-sister goes against me. I want certain things done according to me and according to my wish. When even mother-in-law goes against me, I am a person who will retaliate to her. She said ki I was very good in communication to people, and I don't like that my mother-in-law doesn't support me. So this is what the whole story she had created. Now after this, the whole story unwinds itself, that there was a death in a family, grandmother की death हुई, and after that she said कि मेरे को ना 1 साल तक के मेरी grandmother दिखते रही in white sari, and once so she came to throttle me along with 4 females, and actually I woke up that and I felt that I'm being throttled and kept on, and then someone took me for the black magic, and then things were done ritually, and then I got rid of it. So in childhood, she said, I was very intelligent, I was good in speeches, I was very good in dancing, I was good in as a person to participate in everything. This was what she was creating a story. But then she said gradually ki I was very good looking, है ना? But because of this epistaxis, because of this bleeding episode, everyone says कि everything got affected. I was in fifth standard when everything happened. Before I used to be very good ranker, but now I have confusion. I don't understand physics. So I wanted to become a doctor, a teacher, but because we belong to a small family, my parents, my brother did not allow me to go out. I was not very obstinate and an understanding child. So I had to give up and I studied in my own native place. I'm determined to finish my work on time and I have leadership qualities. This is what she was saying. But then gradually she said, no, I never go on stage. Abhi yahan pe I went for a, I was fortunately the guest where she appeared on the stage. And when she was asked to introduce herself, she was Tata Papa and she could not speak also. There the psychosis was revealed. And she said ki before I was so good, then but in maths I was so difficult, and in 10th I passed hardly with grace marks. She tried to blame that because everything happened because my brother got married to a female, which was wrong. And I am a person who is not comfortable talking to the elderly people. To my age group, I'm very comfortable. So I'm not very good with my hubby. So since the problem came up because my bhabhi came into our life, and after that I started falling sick because I was the amongst the four sisters, I was the only sibling who was for a long time with bhabhi. So I feel that because of that lady, the whole environment had stopped, had got spoiled, and I started suffering because of that lady. And someone told me later on कि भाभी कुछ काला जादू करती है in family, and strong thought that उसके ही कारण पूरी life बर्बाद हुई है. And she would always interfere and create hurdles, और वो कभी नहीं चाहती थी कि मैं लाइफ में आगे बढ़ूं. And I really want to go and hit her on her head once, and I cannot forgive her. I always have those thoughts कि उसके कारण मेरी लाइफ स्पॉइल हुई और उसके ही कारण मेरी जिंदगी बर्बाद हुई. After marriage, the things were like कि there was a pressure of having a male child in the family, and unfortunately she got a daughter. So there were always conflicts with the husband. He never supported her, and she said कि everything started after this because I was being forced to get pregnant, and then I did not get a male child. So you won't imagine, doctor, my husband did not come to receive me or take me to the doctor. I was pregnant alone. I was handling the things alone, and he did not even come to meet my daughter. I was so much neglected and not taken care because my mother-in-law was under that pressure that I want a male child. देन ही सेड कि शी सेड अगेन कि मेरे घर में क्या होता है ना कि मेरे जो जेठ जी हैं उनको बहुत सपोर्ट मिलता है, एंड माय फादर इन लॉ आल्सो फेवर्स हिम बिकॉज आई थिंक दैट अगेन दिस ब्रदर इन लॉ हैज डन समथिंग ब्लैक मैजिक बिकॉज ऑफ विच whole in-law family is under his control, and even my husband is not under my control. I don't know what has happened. So during pregnancy to came also she says ki I came to know ki co-sister is jealous of me, and therefore if everyone is jealous of me and everyone wants to harm me, I she wanted to give me certain clothes which she has gifted to me, but I never dared to wear those clothes, and I was always scared, and I never worn those clothes. So I cannot trust anyone. This is the whole story. Now we are on the feeling where she is being under separation conflict, a devaluation conflict. Okay, both things are here because you will see there is a conflict with the husband where she is being separated. After the daughter, there is separation, there is devaluation, which can be seen at the form of hemorrhagic tendencies also. So aphorism number 213 supports the whole story is कि when there is change in the state of mind and disposition in syphilitic phases, please consider the change in disposition, and this change disposition needs to be taken into consideration for the prescription. Okay. Now come to the rubrics. It's so short, so easy. Let's go ahead. So analysis of the case, she's a boaster, bragard, what I can see, high self-esteem, sensitive to criticism, suspicious, professing dreams, feels black magic done to her, harmed by others. She feels that everyone is enemy around her. She was neglected, rejected by husband, not taken care during pregnancy with a hemorrhagic tendencies. She has the desire to fight back in anger. She's yes, quarrelsome, and she can fight back in anger. Okay. Timid, yes. Confident, I am not sure. I was not sure what confidence she had, because whatever she was saying was not matching the history what she has presented to. So she was definitely a person who was presenting something else and originally something else. So here we want to conclude that what we have seen before we go to the rubrics, this was a way back long case. And so rubrics is separate from separation and rejection, both will come here. There is disappointment, forsaken, deserted, being alone, friendless, indifference. So we can see a separation conflict from the husband side. Delusion, alone in the world. She is, yes, she is not gone into indifference, but there is betrayal feeling, there is disappointment feeling, and she feels that she is not being connected. Okay, persecuted. Now, again, if we go ahead with the theory, what we are trying to connect over here is that the third value system, because we had one first devaluation conflict, then we have separation conflict, then we have a conflict related to. Now, can anyone say third conflict what we can have? Loss of protection conflict. Okay, so she feels that I am not safe, I am exposed, and I have lost my shield, because hair gives you protection, hair gives you that feeling and that thermoregulatory mechanism, that connection to the world and protection from the outer world, because it is a connective tissue and related to the ectoderm and the dermis. So therefore a loss of protection and a loss conflict will also come here. Okay, so what will be the rubrics here? Because it is anticipatory anxiety, a lot of loss of protection, right? So loss of protection will give you lots of anticipatory anxiety, or a lot of insecurities which will happen. You will have a feeling that suddenly you are thrown out of your home, that homeless feeling, that helplessness feeling, that I was being attached to my whole family. Have you seen dogs? They work in groups, right? They stay in groups, but once they have that scabies and they have that scratching, lot of scratching on the body, what happens is they really get disconnected and they go and become lonely, and over a period of time they really lose their life also, because they have that disconnection and they feel loss of protection also. So because they lose their head, they lose their identity, they feel that they are not being protected in the whole herd of group which they were staying. So when you talk about loss of protection, you have the rubrics which will come up are helplessness, the feeling I have lost my shield, I don't feel protected now. So there is a conflict which is being injured will come over here, something which is being insulted, something we are being okay. So if you are being attacked, so loss of protection will come when it is more of autoimmunity. Okay, so your defense is to protect your whole self from whatever scavengers you have around you, right? So when you defense goes against you only, when you try to kill your own self, that loss of protection conflict will give you lot of autoimmunity, which can be seen everywhere. So they lose that life ka sense also, because then your whole sora is to protect your life, survival. So everything will come over here where survival is also at stake. If I don't protect myself, anyone will come and kill me, anyone will come and harm me, right? So fear of misfortune, delusion, danger around me, delusion of being injured, fear something will happen in the future, delusion injury will receive, that fear of loneliness, fear horrible things will happen because I don't feel protected. Something will happen, constant state of anxiety, and that anguishness also will come over here. Because of that anguishness, you feel that something horrified you. You are related to the enemies around and you don't feel protected even in your own home. What happened to this lady? She felt that wherever she was, her bhabhi, her co-sister, her husband, they were against her. No one supported her and everyone was like an enemy to her. So she was like, I want help now. I'm screaming, I'm shouting. All the tissues of autoimmune are like mad, insane, right? They are just running here and there seeking help. Ki, what's happening to this immune? This T helper cells have started killing us. My own major histocompatibility complex have started deteriorating me. So this is what is happening. A strange feeling in the own world. When you start feeling insane to the level ki in your own house, you have been protected. You were being labeled by T cells that this is your own cell. And when your own cell lose that defense, right, and you become more syphilitic, you start killing your own self. That loss of protection is more syphilitic. So wherever loss of protection conflict is there, you will see syphilitic disorders coming up. This is the key. Please understand, wherever the protection is lost, you see the invasion. Like, I'll give you an example. You feel protected over here because your boundaries, your borders are being protected by the soldiers who are fighting. Once your borders are being invaded, you are lost. Okay? So when your boundaries, where you feel this is home, this is me, I am protected, I am under this shell, which will prevent me from injury. When it is harmed, that is what syphilis starts. Okay, that is what immunity starts. I was supposed to be blessed for some good things, and now I've lost my own identity, and now I'm fighting for against my own wish. That is what is syphilis. Okay, despair, lost hope, indifference, discouraged. I feel insecure. I'm coward. I cannot face the world now because so I don't care, take coward over here as that coward of timidity. Take it like when you get hurt by your own family members, you feel that mistrust and develop that mistrust in the whole society. You get into misanthropy and you don't have that courage to come over this loss and face the world, and you go into your own despair phase and you feel that now the life is hopeless and I'm helpless in this situation. Understood? So delusion, home, away. When you feel that you have lost protection, you are away from the home. You feel estranged from the society. Fish out of the pond, because it is not fish out of the pond. No one has kicked you out, but you feel unsafe. Okay, it is not fish out of the pond. Sorry, it is unsafe feeling when your safety is at stake. You feel being separated from your own family. You feel in your own family, and therefore you feel that you are being rejected, right? You are being injured by your own people, and therefore everywhere where is autoimmunity, this will come up. I hope this is very clear, but still the whole thread is understood very well. Anything not understood? Yes, conspiracy. She was under so many conspiracies. Okay? We are going ahead to the case, don't worry. This is where autoimmunity is prime syphilis, okay? Because your home is what Mother Nature has given you. That is the primary defense. And when it is at stake, everything is spoiled. So there is timidity, there is want of confidence. You don't have that confidence even to face your own family. You don't have confidence on your own people that they will secure you or they will protect you. So you are just like estranged. You are just like forsaken by them. And the forsaken feeling is not only of being devalued, but to the level of delusion that you are left alone in this world. So this loneliness will go into that depth. So this is protection. Now, this case, now going to the case analysis, what we have presented. The second case which I have taken. So the rubrics we analyzed was definitely she was not being protected. She felt not safe under society, her own family. She was boaster, high self-esteem remedy, sensitive, harmed by others. She was neglected by husband, angry, fights back in anger. She's timid, she's confident. So the rubric is delusion persecuted that she is. Persecuted is when you feel that you are being harassed or punished in a manner to injure, grieve, or afflict injury. So this was deeply down into herself that she was being injured by her family. She felt that her bhabhi tried to persecute her, then her co-sister, then her brother-in-law, then her husband is also not satisfying her, and she's just struggling to fight over it. Okay. Then the second rubric which we can take is delusion injured is being. Again, here she has a strong feeling that whatever people they are, she's being surrounded by enemies, and those enemies are trying to injure her. Even for the child, she feels that she is not protected. She had a history of abortion. Do you remember? So there is a history of abortion. There is a history of so much unprotected behavior which was there. She also feels that she is under a black magic. She's under a powerful influence, and therefore she can sense so many energies, and people are just doing black magic and they are trying to control her and do things just what you say, just to harm her or create hurdles in her life. So she's under that influence. So the rubrics which I have taken is suspiciousness, delusion, she is being, and hemorrhagic tendency. The remedy which I gave her was lacasis 10 ml 1 dose. Here, fortunately, there were no mistakes. I could get into the disposition, and everything went well. Even after years together, what amazed me was after years together when I met her, she said कि doctor पता नहीं आपने क्या दवाई दी. After that, that giddiness which she failed, I never had anemia. I never faced any complications at that time, and everything was so smooth in my life that till now date I don't have any problems. And even after the medicine, my husband has started looking after my daughter, and he takes care that my daughter is well to do now, and my family is very happy because she is known to me, therefore I know everything in so much of detail. So this is a case of alopecia areata, and any problems in understanding, because there is some issues with the connections. So the third case, which is very similar with the same rubrics, I've just taken over that case. Is it okay? Yes, we can take delusion poison. Is it okay to take psoric and psychotic rubrics for hair fall? See, if it is psoric, then only you can take psora, or if it is syphilis, then don't take just psychotic rubrics. Psora can be taken because we have to give GCS. In what cases? Again, I have gone back, and please understand what is the pathology. It is psora, psychosis, or syphilis. If it is syphilis, then take frank syphilis ka rubric, prescribe on that basis, because this case had come to me with so much of hair loss, and this was there since more than a year. She was suffering, and she also had so much of bleeding tendencies, abortion, frequent fevers, which were really taking her energies. So this was syphilis. So therefore I had to take the deep core delusional thought which she had, that she's being injured, she's being persecuted, and also that she is being poisoned, and she's under certain harm, under certain extra power, what she was telling. So this all is syphilis what we are covering, because only 1 dose I have given to this patient. No other repetition was required, and wonderfully after 10 m, because it is autoimmunity, I have also seen in the previous cases, if I am giving 200, it is not giving me results. I have to give 10 m. In the previous case where natramur was there, I repeated few doses, but I think that was even not needed because the case was really very good. When natramur 10 m was released, everything came into a proper picture and things were improving. Symptoms and miasm, I don't think it is there. This is what I'm compiling in my lectures, an effort that yes, miasmatically symptoms are there, because every symptom you have to understand from the pathophysiology book, and from the pathophysiology book, then you have to consider the miasmatic background. So let's, I think you all are attentive and not tired. should I take the third case, or I did not actually need any GCS in this case. She also suffered from uterine fibroid and bleeding hemorrhagic tendencies. But she said recently when I met her that no, everything is fine. I did not need any hormonal treatment till to date. She had come to me almost 8 years back. So moving ahead with the third case is a very similar case. This case is of a 5 years female. Again, she has come with hyperacidity, heartburn, chest pain, and a huge alopecia spot which was there with melasma and irregular menses, hypertension. You can see this whole patch. The figure is taken from very close. So this was a case in 23 which came to me. So you can see the whole patch. This is the anterior part. The first picture is the anterior part where this front end was there. So the whole hair could not cover her baldness. Then there were few patches here and there on the scalp, and the whole patch was extremely smooth. She is not from an affording family. Still, her husband took her to so many doctors for the treatment they applied. She had brought a box to me, right? You won't imagine, she had brought a box कि मैम इतना सारा सीरम यूज कर लिया, इतना सारा दवाई खा लिया, पर कुछ भी बेटर नहीं है. In fact, पैचेस बढ़ते ही जा रहे हैं. She could not recognize her first spot when she came to me. बोले मुझे अब याद भी नहीं है, इतने स्पीड से बढ़ रहा है कि रातों रात पूरे पैचेस बढ़ जाते हैं. तो आई डोंट रिमेम्बर फ्रॉम वेयर इट स्टार्टेड. सो इन चाइल्डहुड शी सेड कि मुझे बहुत झटके आते थे एंड मुझे फील होता था कि कोई तो भी मुझे वियर्ड सेंसेशंस आते थे, जैसे मैं कार रेसिंग को देख रही हूँ और बहुत स्पीड में जा रही हूँ, एंड दैट वाज अगेन अ ब्लैक मैजिक. And I had dreams of snake. So that age also, 10 years of age, there were so many weird thoughts in my family that I was being taken up for that babhuti, and with that vibhuti I was better. There is also a moon aggravation, which she said that every time there is Amavasya or Purnima, this chest heaviness aggravates. I feel that some load is kept on my chest, and that oppressed feeling on my chest is so heavy and so suffocating. I just wake up suffocating because of this chest heaviness, and I've noticed this key. All these symptoms are not only because of moon but also come during Amavasya and Purnima. In early childhood, whatever she described, that my mother, we were in a very small village, and my mother was really a very hard working lady and a very dominating kind of a female. Her mother's case is also with me, so I can see that yes, she was very dominating. And वो बोले कि we were from a poor family. My grandmother was not so good with us, and but my mother was very strong-willed, courageous. Whenever she used to go to wash utensils or clothes near the river bed, no one could dare touch the place where she used to occupy. No one could just come and just stand over there also. She would fight back, retaliate. My father was alcoholic, but still there were no conflict as such in the family. There were few conflicts in the family where my father got violent and abusive over mother, but my mother was really very strong and she could fight back. I'm not like my mother. I'm really not like her. I cannot fight back. And whenever I have to face such situations in life, I get convulsions, and I something happens to me and I get weird expressions, and I go into that behavior that people feel I have gone into convulsions. After death of brother, there was a sudden shocking incident in a family at early age, that her brother died due to some accident, and because of which the whole shock in the family came. And the mother, who was very strong, she just lost her power and will, I should say, and I had to handle responsibilities of the family. I was also shocked. I had those convulsive episodes, but because my mother was crippling down, I could not cripple down. I have to leave my studies and started working overseas and earn money to support my family. Even 10 rupees was too much for me, and I started earning a single penny. Till date, we have financial crisis. I understood the role of a daughter in the family, and I have that anxiety that as I lost my brother, I should not lose my mother in my life. I have a strong support of her. So I became caring, helping, and sympathetic towards her. And I was never partial with anyone. Whatever care I gave to my mother, I gave to others also. After marriage, what happened is I was married in a family which was a poor family. My husband is very docile kind of a person. Okay, he always supported me and he was always caring of me. Whatever treatment doctor we had, wherever he could take me for the treatment, he has taken me. He has never said back. There is always a conflict with my Jithani. She always comes here and stays with hers. And I remember all my complaints started after the death of my father-in-law. Because we were staying separately, she would not tolerate me, and so many fights were there with her. I would fight back to her whenever it came upon physical fights. And she was so cunning lady that she had kept a deepak in the shop where we kept. There was a shutter in our home. We were just constructing that place, and she purposefully kept a lighted diva, and she closed the shop. My husband saw it and could save the whole building. And she was always behind creating some pranks to injure us or spoil us. And during pregnancy, I came to know from the neighbors that my co-sister is really feeling jealous of me and she wants to do some black magic. Everything shattered, and I started all these complaints recently because I stopped talking to her and can fight back to her. Suddenly, what happened, because my in-laws, they were staying with her, we were just providing lunch to them or tiffins to them. So when my father-in-law died, suddenly she changed her behavior for 3 to 4 days and she asked me to come and stay at her home. And I don't know why she purposefully came to hug me, and she has just moved her hand on my scalp. Since then, I have started losing my hair, and she used to always insult me, saying that I'm from a town place, I'm from a small village, which is really hurting to me. And suddenly this changed behavior was indigestible to me, and I started feeling very uneasy that this lady who always insulted me, offended me, made me anger, how is she behaving so good with me? So because of that, I was really moved and was surprised what is happening. And then this anxiety episode started because I couldn't trust her. And after that day, every new moon, I used to feel very weird thoughts coming to me. I would feel that sensation of being tied up. Husband would never fight back for me, and he was very weak-willed. So I had to come in front and fight. My daughters are attached to the father and to me also. So my elder daughter would never leave me. And what happened is, in this family situation, when my father-in-law had died, my husband was not taking up the charge so well. So I had to come in front and protect my children, and we decided to move away from the house. And we started reducing the share what we were given for the expenditure. So she would insult us, and I believe that whatever is happening wrong is because of the black magic she has done to me. I always fight with my husband next day, and I always express my anger for taking alcohol, which I don't like. I am a person who will live with simple food but don't like alcohol. So fear something will happen to me, worried about future, about my daughters, ki I cannot trust my co-sister now and cannot leave my children behind on her trust. So I want to just change this home and leave this home after the death of father-in-law. And because of that, whenever those thoughts come up, I get an oppressed sensation on my chest and fear that death will come up and I will not be alive. So, what will happen to the future of my children? And I cannot stay alone because of these constant thoughts. I get very nervous, I get anxious, and husband has to run and take me to the hospital. Doctors say कि BP बढ़ गया और कुछ भी नहीं हुआ. But I cannot tolerate any antihypertensive medicines also. So because I'm constantly into worried state about my daughters, my elder daughter is more attached to me. The younger daughter is more attached to the father. So they both force the father to quit alcohol. But I feel that I've never done any wrong in my life, still why I am suffering. And she said, I have been taking so many medicines, and why the person is suffering is $1 million question. Now you understand, in all the cases what we have is what is her constitution. So if it is psora is still alive in the case, still the structural pathology is not advanced, it is in psychotic phase, please prescribe GCS. If her disposition from childhood till now, if there is a change disposition because of the syphilis, the remedy will be based upon the syphilis. Then how is she fighting? What are the reactions? What she has to the environmental stresses? What she's perceiving from the environment will be the ailments from, and how she is behaving is the reaction which defines the constitution she is having. So GCS will be depending upon all this, and what brings her devaluation, separation, or what breaks her down, what are her reactions which have changed, and what tissues are affected. In totality, when you have to build up a complete totality, these are the points which we have to understand. What is her constitution? Is it a change disposition? What is her miasmatic background? How is she reacting to the environment? How is she perceiving the environment? So in this case, again, you have delusion persecuted, delusion being surrounded by nini, black magic, underpower, whatever. So whatever changes the disposition has completely changed. Consider the change disposition, the syphilis. This is the key to prescription in autoimmune diseases. Okay. So case analysis, she is an extrovert, diligent, sensitive to quarrel. More than diligency, I will say she is responsible. Since childhood, she has been suffering with black magic. Shock was death of brother. Therefore, she had to take early responsibility, caring, sympathetic, conscientious lady. She never cheated anyone for that, but she's sensitive to criticism. She's trapped into her own world of insecurities of future, of her daughter future. She's suspicious because she feels being injured. There is a lot of anger in her, not equivalent to the reaction what she has given. She says that she was courageous before, but now when I see the whole picture, I don't find so much courage in her. She's caring for family, definitely attachment, anticipatory anxiety, intellect is good. She felt insulted and humiliated by the co-sister. She was looked upon, support of husband, financial worries, constant anxiety and worries. So you will find over here is after death of father-in-law, the constitution has changed. There is hysterical behavior which has come up. There is fear of death, fear of alone, anticipatory anxiety. She has become more superstitious, confidence poor. She has become suspicious, future anxiety, done black magic, chest oppressed feeling, anxiety health, weeping is there, hysterical behavior is there, helplessness is there. She cannot fight back. Okay. So, what is the cause in this disease? How to search the cause and relationship? What is her sensitivity? What affected her more? What did she react to stress? So I think the financial crisis were there since childhood. She was not affected with that. She was not affected that she was thrown away from the family. She was more affected with the injustice which was being done by the co-sister's behavior, death of her father-in-law, after that loss of support which she had, that separation conflict, and then that anguishness for the future. Now what will happen? So homesickness, homelessness is also there, separation conflict is also there, then devaluation, I will not be able to handle the whole situation. So ailments from fright and fear, delusion persecuted, fear death of, delusion injured being, and delusion influence is under. The remedy went well was lachesis. Here again, you can also think of hysterical remedies in these cases like sepia, stramonium also can come up, because stram also has such reactions where they go into hysteria and hysterical, but her strong belief that she was being under influence of black magic and things were going under against her. So again, the final prescription will be based upon the syphilitic trait which she has, the change disposition. And in this case, after the things had gone, I had to give her sepia. I gave her sepia as a prescription. So this holds true to certain extent that disposition of the patient determines the selection of homeopathic remedy. This will also stand true that if you don't match the disposition of the person, it is not a true simillimum. And also that if you are going with the individualistic approach, you have to really understand the whole constitution, the cause of the disease, the reaction of the disease in totality, and the perception which has gone wrong, and the gear has shifted from psora psychosis to syphilis. That is a behavior which is self and destructive towards themselves. And you will see that over a period of time, 6 to 8 months only, the hair growth was there. If the remedy is right, friends, the hair growth should be uniform, the hair should come, and the front hair was covering the scalp very well. Beautifully, this case got cured up. And after that, remember that oppressed feeling she had on her chest is gone. She never needed, very few times she comes now because her hyperacidity is total gone. She was not on any hypertensive, which was being suggested. She was not needing also after that. And this is in 23. This is second month. This is third month. You will see that how the scalp area started covering. These are the small hair strands which started coming. And this is third month. So lots of gratitude to you people staying back with us. Yeah, I took delusion persecuted also, delusion wrong suffered also, delusion injured also, you can take. And here, because this is a case of complete psychosyphilis which was there, and there was lot of hysterical episodes which were happening, so hysterical remedies should come up. This was a phase minimum according to me, because the hysterical episode was in full bloom that time. She was she would not even get attached to whatever I'm asking, so she had to settle down. And after giving the remedy, to my amaze, that she was fighting for her finances since a long time. She was searching for the job and she was not getting it. And after this, she could settle with her age, she could settle with her health issues, and she got a job. And now she is running her bread and butter along with the husband. So the financial crisis have gone down. She is able to fight with her daughter-in-law, and she has again gone back to her family where she has constructed her own home. And here also she did not have any hysterical episode which went out of control to her, and day by day she is improving relationship also with her family and around. So this is the whole crux of alopecia in general hair loss. So there has to be devaluation, there has to be separation, right? So everything needs to be correlated like the beads of the thread. You must be like, why you have to take anatomy, why you have to understand pathology, you have to understand physiology. So we connected everything from the base, from the resources, going step by step to the pathology, and then connecting the whole threads of emotional pathology, because when psora gets compromised, syphilis comes up. So connecting psora to syphilis, taking help of psychosis. This is the whole presentation being done. I hope I played my roles very well. See, if you have taken a case very well previously only, and you know the disposition of the person in the early childhood, and if the person has truly been honest while giving the history, what Hahnemann sir has guided very well is when you have a change disposition and when the totality is completely, he has given a beautiful guideline that if it is a change disposition, please go and review the disposition and change the remedy when required. Yes, hair have improved. You can see in the pictures we have documented very well, and you can see that the hair have become very beautiful. And this is in 23. The patient is still with me in 26, and we can see that there is no hair loss till now. We needed sepia definitely as a constitutional for her, but it has gone wonderfully well. I think it was well explainable. This is what you all have been searching for. But again, I will say ki don't just go with only certain things restricted, but go to everything which is being there, and don't leave anything, because everything is very important when you understand a case. Everything has got its own value. Eyelashes should come up, but they should not be very short. See, if you are returning back to the normal physiology, to the normal anatomy, it should be wonderfully what the nature has given. If it is short eyelashes, but if it is not covering everything, then I think you are very close to the simillimum, but not the exact simillimum. Okay. So let's call it end of the day. Thank you for all the appreciation, and thank you and gratitude to everyone for giving me this opportunity so that I can share things with you and I can really share my knowledge, my experiences. Thank you. Thank you. Gratitude to everyone. If any doubts, questions, please put it in the chat box. Spread this message that how we are working to everyone. And please do share your experience journey with me, whatever learnings you have. If you have applied to the cases, please do share, because we are students of Sir. We accept whatever if mistakes we have committed, we are ready to change it. Thank you so much.